I would like to share our experience from the North East and Yorkshire on one of our innovative TEAS remote ECG project. The project was about use of a remote ECG monitoring device called AliveCore 6-lead ECG device. And this device, we used it as a project in our trust for monitoring patients who are on antipsychotic medication and also initiating patients on antipsychotic medication. The reason for this project to take off is the pandemic. During the pandemic, as we all know, routine investigations have been stalled or postponed, and then some of our patients were not able to access ECG. And at that time, we found this innovative device that could be used remotely using Bluetooth technology, and we thought we will try to look at this as a usability. And what we did as an improvement methodology, we used a PDSA cycle. We planned how we want to implement this project, and then incidentally, because it was a COVID pandemic, we were able to get some engagement from our trust senior leadership to get a go-ahead to try it out. And then while we were doing this, we thought we will get a real-world evaluation of how the benefit of this using this device was. And so we started with the implementation of the project with 30 devices as a pilot project. And then we also did a real world evaluation on what are the benefits of it. We used the device in the community, taken by our nurses and support workers. And then we asked the patients about what do they think about the benefit of using this device. And as you can see from the graph, patients really loved it. They thought it is easy. It was quite useful for their dignity and privacy. It was very quick. And then they thought this will be the future preferred method of ECG recording they would like. And then again, you could see some of the staff feedback that staff felt that it was really useful. And they also thought that, the amount of ECGs you can do in a short period of time is really quick. And in fact, one of our staff members said, if you take it off me, I will cry. And also on a kind of a quick economic kind of analysis we did was this actually improved time to care by the nurses to the patient because we could save around 17.5 minutes between the conventional ECG and this new ECG, which is the time the staff could provide to care for this patient and also provide psychological input. So just to the things we learned from this improvement project is that we had few kind of initial kind of concerns. People were worried, is it effective? The quality of the ECG. I must admit the quality of the ECG, you get this from the tiny device you can see on the picture is amazing compared to the conventional ECG. And the key learnings are change can be scary, but the global pandemic made us that it is necessary to embrace change. And we needed a group of multidisciplinary staff to support us with the project and also supporting, facilitating training for everyone, and then starting to upscale the project and share and spread way for everyone to take it is really important. So I do think that with this project that we were able to break some of the barriers during the pandemic. If it was pre-COVID, probably I don't think we would have very quickly scaled it up. We were able to plan, do, study, and then act and upscale in a very quick way. And we need to learn this in the future so that this kind of innovation is embraced across the global healthcare. Thank you.